People who work with drug users at Ontario's safe consumption sites are angry over the province's new restrictions on where the centres are located and its ban on opening new ones. The workers say the government's plan will lead to more deaths and put more pressure on a struggling healthcare system. We get the details from the CBC's Megan Fitzpatrick.
Today, advocates called on Premier Doug Ford to reverse his decision. They say instead of closing these supervised consumption sites, they need to be expanded and scaled up even further. They said they have no doubt that these sites save lives and that by closing these sites, people will die. One of the speakers at the news conference said this is akin to the government handing out death sentences. They said there is a toxic drug supply crisis going on right now, and the Ford government is not doing enough to address it. They said these sites are a key part of responding to that toxic drug supply crisis. Workers who spoke at the news conference said they are devastated by this decision. A registered nurse who works at one of the sites that will be forced to close said in 2023, workers there helped respond to and reverse more than 500 overdoses. She laid out some of the consequences she says will arise by closing sites like hers.
Eliminating sites will increase public drug use, will increase public disposal of drug use equipment, will increase the incidences of bodies being discovered in alleyways, in parks, in Tim Hortons bathrooms, in libraries, and it will increase HIV and hepatitis C rates, and it fundamentally denies the right of a group of people their access to needed health services, period.
The workers said there is a lot of evidence about the benefits of these sites and that they provide much more assistance than just the supervision for people using drugs in the centers, that they do connect people with primary health care, for example, and other social services. They said that no one from the Ford government has ever sent a representative to any of their sites to meet with the people that work there. They said Ford claims to be on the side of workers, but yet he has not listened to these workers or even consulted with them when making this decision. So again, they urged him to reverse the decision, and they're calling on the public to support them as they try and fight to keep these open. But Premier Doug Ford today defended the decision once again, just like he did last week. The announcement was made by Health Minister Sylvia Jones, and the announcement includes prohibiting these centers from operating within 200 meters of a school or daycare, which ultimately will mean 10 of 17 of these sites across the province being forced to close by the end of next March. The province instead says it will be funding new heart hubs, they call them, homelessness and addiction recovery treatment centers. They're going to spend more than $300 million on these sites. Premier Ford has made it clear that is the direction he wants to go in. He calls supervised consumption centers, safer supply, all of these kinds of approaches, failed policies.
I'm not a fan of the federal government's safe supply. I compare it to giving people poker chips, dropping them off in front of the casino and saying go to town, or give them all a free pass to LCBO all day, all night. That doesn't work, folks.
And when asked last week about this accusation that people will die because of this decision, Health Minister Sylvia Jones rejected that notion, saying people are not going to die, they're going to get access to service. Premier Ford saying again today he thinks this is the right direction for the province to be going in, and he's proud of the government's decision. Megan Fitzpatrick, CBC News, Toronto.